In what cases and what exactly do we feel discomfort in our back? A general spasm of our quadratus muscles. The pain can be located roughly in this area of the buttock. This is pain between the shoulder blades, which can radiate anywhere upwards, downwards, or pain in the piriformis area. Right here. I assure you that even after doing the exercise, you will feel relief because you will be working with the trigger points in this area. Hello everyone, friends. As always, we are on the Healthy Movement channel. My name is Maksym Mamchur, a physical therapy specialist and co-founder of the Healthy Movement Kinesiotherapy Center network. Today we'll discuss an interesting topic. We will talk about back pain, specifically about the cases and the exact issues that bother us in our back. As you understand, there are different cases. One person has pain on the right, another on the left, a third feels burning, a fourth has chronic pain, and a fifth has pain radiating down the leg. Today, we will go through all these cases and learn how to relieve each type of pain with the help of exercises. So please stay on the channel, subscribe if you haven't already, and let's get started. So first of all, chronic pain that occurs roughly in this area. What could this be? It could be a general spasm of our quadratus lumborum muscles. Our quadratus lumborum muscles attach to the lower rib as well as to the crest of our pelvis. Accordingly, when they are contracted on one side or the other, we feel tension in them, and as a result, we feel pain in them. The cause of this can be an anterior pelvic tilt and pronounced hyperlordosis. Today, we will first discuss what to do about this, how to stretch, and how to restore normal tone to these muscles. Next, the piriformis muscle, also known as piriformis syndrome. We encounter this quite often in our practice. What appears? What kind of pain? The pain can be roughly located in this specific area of the buttock. The pain can radiate down the leg, causing a burning sensation, or it may be a chronic, constant pain. It may even get easier in certain positions, while in others it gets worse depending on the overall condition of the piriformis muscle itself. Why does this happen? Let me explain. The gluteus maximus muscle, here it is shown, its function is to move the leg backward. Accordingly, when our gluteus maximus muscle does not properly perform its function of moving the leg backward for a long time, synergist muscles appear that begin to help it. And in this case, the piriformis muscle gets involved. But moving the leg backward is not really the piriformis muscle's job. As it tries to perform this function, it contracts and starts to compress the sciatic nerve. Against this background, we experience localized pain, which can also radiate down the leg. What should we do about this? I'll also show you how to address this in today's exercises. And third, the interscapular area. The pain can be somewhere here at any of these points. It can radiate between the ribs, radiate upwards, or it can just be a constant localized pain between the shoulder blades. What does this mean? This indicates constant static overstrain in the interscapular area, suggesting a prolonged period of stress. Let me explain. We have inspiratory muscles. These are the muscles that lift our shoulders up, and there are also expiratory muscles that lower our shoulders during the act of inhalation and exhalation. Accordingly, when our inspiratory muscles are too strong and overstrained, the expiratory muscles will always be too weak because they are antagonists to each other, and with static overstrain, trigger points will develop in them. What does this mean? It means that the back is trying to return our shoulder blades to their physiologically correct position, like this, but these muscles don't have enough strength, and as a result, they are constantly in a state of static overstrain, developing so-called trigger points. And today we will also discuss what to do about this, how to bring our shoulder blades back into good posture, and how to relieve the constant overstrain that can radiate to the neck, between the ribs, and sometimes even downward. So stay tuned to the channel. Let's start doing the exercises. So the first exercise, we will stretch the quadratus muscles, which most often cause tension directly in the lumbar region of the spine. They cause that chronic, constant pain when extending. So what do we need? First, we need to find a doorway. Why? So that you can grab onto the doorway with your hands and hold on just like this, as you can see our model is doing now. Second, we need to pull back. At the same time, round your pelvis as much as possible and your knees can be slightly bent. And third, we perform these gentle side-to-side stretches of the quadratus lumborum muscles, which are located in the lower back. Let me remind you, the muscle attaches from the lower rib to the iliac crest. So when we do these twists to the left and right, our muscle stretches. We perform this exercise 15 times on each side, taking our time and carefully avoiding any sudden, overly sharp or abrupt movements. If you experience any sharp or intense pain while performing this exercise, it is always best to immediately stop the movement. Instead, use gentle flowing movements from side to side. You can effectively use your breathing to assist you in this process. Exhale slowly and deliberately with each and every movement to help the muscle relax even more deeply. When we gently turn our body to the left side, the left leg naturally bends. Conversely, when we turn our body to the right side, the right leg naturally bends. 15 repetitions on each side. Now the second exercise, pain in the piriformis area, right here. Sit down on a chair. Take the leg that's bothering you and place your foot on the other leg. And what do we do next? We simply lean the torso forward, stretching the piriformis muscle this way. Return to the starting position. If there is sharp pain, don't push into it. Go only to the edge of the pain, then return to the starting position. Do 15 to 20 repetitions exactly like this. Be absolutely sure to slowly exhale as you gently lean your body forward. Why is this necessary? First of all, we don't strain ourselves and our blood pressure doesn't rise. Secondly, by slowly and deliberately exhaling, we help our muscle stretch more completely and return to its proper physiological position, thereby effectively reducing compression on the sciatic nerve and, accordingly, substantially decreasing overall pain. You can also do 15 to 20 repetitions on the side that doesn't bother you at all. And the third problem is pain between the shoulder blades, which can radiate anywhere, upwards, downwards, into the ribs, and sometimes even into the pelvis. Our task is to engage exhalation muscles, which need strengthening, and pull our shoulder blades downward. How do we do this? Place your hands in front of you, just like this. On the exhale, bring your shoulder blades together and reach down with your elbows. Make sure that the upper part of the trapezius muscle does not tense up. Only the area between the shoulder blades and the lower trapezius, the lower part of the trapezius muscle, should be engaged. Do 15 to 20 repetitions like this. If there is sharp pain, we avoid it. Work within the comfortable range of motion that does not cause any sharp pain. If it still persistently occurs, it's always better to stop and consult your doctor or a physical therapist. At the same time, our neck remains in a neutral position. It doesn't move forward or backward. Our goal is to strengthen only the area between the shoulder blades and a bit below it. I assure you that after doing the exercise, you will already feel relief because you will have worked on the trigger points in this area. Accordingly, the blood supply there will improve, the tension will decrease, and the pain will gradually subside. And at the very least, with the help of this exercise, you will improve your posture, your shoulders won't be slouched, you won't have your shoulders rolled forward, and as a result, at the very least, you'll look better aesthetically. How did you like this episode? Did you enjoy it? Should we go into more detail about the problems of localized points in our spine or joints? Please let me know in the comments. It's important for me to know whether to talk about things in general or to focus specifically on the different syndromes that can occur with back pain, pain between the shoulder blades, neck pain, and so on. If you enjoyed it, please like the video and subscribe to the channel. I'm always happy to read your comments and stay healthy.